South Africa is alive with tension tonight after explosive accusations surfaced from Manotsi, claiming that President Cyril Ramaphosa embezzled billions of rands that were meant for the nation's hospitals. The revelation has sent shockwaves across the country, leaving citizens outraged and demanding answers. At a time when even the most basic healthcare remains out of reach for many ordinary South Africans, the suggestion that vital medical funds may have been siphoned off at the highest levels of government has triggered a wave of anger, disbelief, and frustration. Before delving deeper into this developing story, the channel's audience is reminded to subscribe and turn on notifications to stay updated on South Africa's most urgent political scandals and critical national events shaping the country's future. According to Manotsi, this alleged theft is not just another tale of corruption, it is a direct assault on human survival itself. In a recent press conference, Manotsi declared that his findings revealed how billions of rands designated for public hospitals were embezzled and funneled into private accounts. He directly implicated President Ramaphosa as being at the center of a vast corruption network that redirected taxpayer funds away from essential healthcare projects into shell corporations and offshore accounts. Manotsi described what he called a systematic looting operation, where money intended for hospital reconstruction, medical supplies, and infrastructure upgrades was instead absorbed by politically connected elites. Layers of fraudulent contracts, tenders, and consulting arrangements, he alleged, were used to conceal the operation and legitimize the theft. If these claims proved true, the scale of corruption would be among the most catastrophic in South Africa's modern history. Manotsi painted a haunting picture of what could have been. The stolen billions might have transformed the nation's struggling healthcare system, constructing new hospitals, upgrading outdated facilities, employing more doctors and nurses, and saving countless lives. Instead, he claims, that money disappeared into private hands. To understand the public fury surrounding these allegations, one only needs to look at the state of South Africa's healthcare system today. Across the country, hospitals are running out of medicine, equipment lies broken or obsolete, and understaffed wards leave patients waiting endlessly for care. In some areas, families are forced to bring their own bedding, gloves, and bandages because hospitals cannot supply them. For years, South Africans have asked the same painful question: where is the money going? Despite billions being allocated annually to healthcare, the results remain invisible. Manotsi's claims now offer a disturbing possible answer: corruption at the highest level. President Ramaphosa, long admired as a reformist and anti-corruption crusader, now finds himself under immense pressure. His carefully built reputation as a man determined to cleanse the ANC and restore integrity to government hangs in the balance. Should Manotsi's allegations prove true, Ramaphosa would not merely suffer political humiliation, he would face charges of betraying the very citizens he swore to protect. The accusations have rocked the ANC to its core, igniting fierce divisions within the party. Some members have rallied to defend the president, dismissing the allegations as politically motivated attacks, while others view this as an opportunity to challenge his leadership and push for new succession plans ahead of next year's elections. Behind closed doors, ANC insiders are reportedly in turmoil, some calling for unity, others quietly discussing strategies for replacing the president. Meanwhile, opposition parties have seized the moment. The Democratic Alliance, Economic Freedom Fighters, and several smaller parties have all demanded an immediate, transparent investigation into the alleged theft. They insist that if public funds were indeed stolen, every individual involved, regardless of their status, must face justice. Public outrage continues to escalate. Across townships, cities, and rural communities, citizens are taking to the streets and to social media, expressing anger through trending hashtags like #HospitalFundsStolen and #RamaphosaMustGo. Heart-wrenching stories are being shared online: loved ones lost due to collapsing hospitals, surgeries delayed for months, and clinics forced to shut down for lack of resources. People are asking how it is possible that billions can disappear while children die from curable illnesses. For many, This scandal transcends politics, it cuts into the moral fabric of society. Stealing from hospitals and the sick, they say, violates a sacred boundary, representing not only a betrayal of the Constitution but of basic human decency. Still, not everyone accepts Monotsy's account. Critics urge caution, arguing that extraordinary claims require extraordinary evidence. Without verified documentation or financial trails, they warn, such accusations could easily be dismissed as political fearmongering or tactics to destabilize the presidency ahead of elections. But Monotsy insists his evidence is concrete. He claims to possess files, bank statements, and internal memos that directly implicate Ramaphosa in the flow of embezzled funds. He has promised to release these materials publicly soon, saying they will leave no doubt that billions meant for hospitals were funneled into private accounts. If these documents are indeed made public, they could set off a chain reaction, potentially leading to criminal investigations that reach the highest echelons of government. Legal experts suggest the case could extend beyond the president to include senior cabinet officials, corporate executives, and financial intermediaries allegedly linked to the money trail. The stakes could not be higher. Should these claims hold, this would go far beyond a political scandal. It would represent a collapse of trust in the very institutions meant to serve the people. The tragedy of this alleged theft lies in its human toll. Every rand that went missing could have saved a life, provided a hospital bed, or funded a vaccine for a child. The losses are not just financial, they are measured in suffering, grief, and broken hope. For most South Africans, the issue now surpasses party loyalty or political rivalry. It is about justice, accountability, and survival. It is about whether those in power still answer to the people they serve and whether the country can ever restore its faith in leadership after decades of corruption. Civil society groups, religious figures, and healthcare unions have joined the swelling movement demanding transparency. Protests are being organized in major cities, and the pressure is intensifying for President Ramaphosa to personally address the nation. Thus far, the presidency has issued only a brief statement denying all wrongdoing and labeling Monotsy's claims as deliberate fabrications. But many believe that silence only fuels suspicion. Each passing day brings louder calls for truth. The people want evidence. They want names. They want justice, not excuses. And if it turns out that money meant for hospitals was truly stolen, South Africans are determined that the truth must come out. No matter how powerful the individuals involved may be, the nation deserves answers, and the people deserve the truth.